How to avoid MS misdiagnosis. How can we avoid the misdiagnosis of multiple sclerosis? This is an important question, as accurate diagnosis is crucial for effective treatment. Multiple sclerosis, often referred to as MS, can be tricky to diagnose due to its symptoms overlapping with other conditions. Let's explore how to navigate this complex landscape. First, healthcare providers must use the established McDonald criteria correctly. These criteria help diagnose MS by combining clinical signs with objective evidence from magnetic resonance imaging and cerebrospinal fluid analysis. It is essential that the clinical presentation matches a typical MS pattern, supported by neurological examination findings. Relying solely on symptoms without objective evidence can lead to errors. Next, interpreting magnetic resonance imaging accurately is vital. MS lesions have specific locations in the brain and spinal cord. They are often found near the brain cortex, around brain ventricles, in the brainstem, and in the spinal cord. Recognizing these patterns is critical. Advanced MRI techniques, such as looking for the central vein sign, can help differentiate MS from other similar diseases. If MRI findings are unclear, seeking a second opinion from a neuroradiologist is a wise choice. Cerebrospinal fluid analysis for oligoclonal bands is another important diagnostic tool. The presence of these bands supports an MS diagnosis, but they are not exclusive to MS. Therefore, results should be interpreted alongside clinical and imaging data. If the cerebrospinal fluid findings are negative or atypical, it may be necessary to consider other diagnoses. Clinicians should also remain vigilant for conditions that mimic MS. These include neuromyelitis optica spectrum disorder, lupus, vitamin deficiencies, infections, and vascular issues. A thorough differential diagnosis, along with appropriate testing, can help avoid premature or incorrect labeling of MS. It is crucial to approach the diagnosis cautiously, especially when there is no clear clinical relapse or when symptoms are atypical. Rushing to diagnose MS in order to start disease-modifying therapies can increase the risk of misdiagnosis. Sometimes, additional follow-up and repeat assessments are necessary before confirming the diagnosis. Lastly, patient history and clinical examination are foundational. Objective evidence must support reported symptoms. Misdiagnosis often happens when subjective symptoms are emphasized without corresponding neurological signs or imaging findings. In summary, avoiding MS misdiagnosis involves careful application of the McDonald criteria, accurate MRI interpretation, cerebrospinal fluid testing for oligoclonal bands, comprehensive evaluation to exclude mimics, and cautious diagnosis. Seeking specialist input and second opinions when needed is also beneficial. This approach reduces the risk of incorrect misdiagnosis, preventing unnecessary exposure to potentially harmful treatments and the psychological and economic burdens that come with misdiagnosis. Always remember, consulting healthcare professionals is essential for personalized medical advice.